First of all, we have to make a very, very thorough physical exam, because we have to make sure that there are no other causes. We have to remember that the way the body is built is bone as the core, and then muscles, tendons, and ligaments reinforcing and giving some strength to that base that are the bones. So when for some, if something happens to those ligaments or to those muscles, then the joints and the bones will be affected. So we have to rule out some any muscular cause for this pain. When we rule every other cause, we might start ordering x-rays. Here's an x-ray of a knee, but we can do it with other joints, basically trying to assess how the space that is between the two bones. So basically there you can see the knee, which has basically, well, 3 bones, but you can see that in the middle there is space between between the 2 bones, so they're not really touching, which might not suggest osteoarthritis. If they were, then we might see or diagnose osteoarthritis. Lab work, we do it to rule out other causes for joint pain, including infectious diseases, and of course some labs that we do to rule out rheumatoid arthritis. So we might request this. Like I said before, there is no actual cure for it. There are certain therapies that are now that they give very good results, but there's not a definite cure. First, we treat with basically anti-inflammatories, non-steroidal, which are good for the pain and good for the inflammation. The downside about them, as I mentioned before, is that they are a little tough with the stomach. So they really, really long-term, they might produce gastritis or even ulcers. So we have to take them for short periods of time. But they are very good at relieving symptoms. Actually, ibuprofen and naproxen, especially, they're very, very good to relieve osteoarthritis pain and swelling. Physical therapy is very, very important, and it's the same explanation that I gave with medical examination, with physical exam. If you strengthen your muscles, then they might help you release some tension from the joints. So physical therapy and exercise in general is very, very good for osteoarthritis, and might actually be the reason why it's the numbers are rising, because we now do less exercise, so our spines are weaker, so they curve, and our knees and our muscles are weak. So we are basically putting all our weight not on the muscles but on the bones and creating osteoarthritis. We can do what we call intra-articular infiltrations, which basically we go to where the synovial fluid is, and we inject steroids and anesthetics to relieve some of the pain and to help with the inflammation. This helps a lot. It's very, very commonly used. Maybe we're overusing it because we have to remember that steroids also have a lot of secondary effects if we use them for long periods of time. But for short periods, it's very good, and it's very good at relieving some symptoms. It's not a definite cure, but definitely will help you. And eventually, once the joint is basically at the end stage, then we do surgery to replace that joint. So we're very good at doing knee replacements, hip replacements. There are even shoulder now, and some others, but those are the most common. And this in a certain way might not cure the condition, but definitely will take your symptoms off. Of course, it's a very invasive procedure, but it has very, very good results.